Hi, Tania.
Hi, Andy.
Thanks so much for agreeing to do this interview with me today. Can I ask you to start by introducing yourself, please?
Yeah, sure. I'm Tania Farrow. I'm the Chief Officer for the Suffolk Local Pharmaceutical Committee. I know that's a bit of a mouthful, so what it really means is that we support all the community pharmacies across Suffolk, and we've got about 136 at the moment, just around service delivery, local services, national contracts, so that sort of thing.
All right, thank you. I didn't know it was quite that many. That's
Yep.
good to know. So, Tania, I've got 4 questions for you, and the first one is this. It's quite a common question that I kick things off with. It's personal and work related. How are you looking after yourself during this pandemic, and how are you supporting your team?
Okay, that's a good question. So if I start with the team first, we're actually a very small team. There are just the 3 of us, and none of us work full time. So obviously at the beginning of the pandemic, that was quite a challenge because our workload sort of increased massively overnight. I suppose in the same way as everybody else, a lot of our challenges came not just from work, but from the fact that everybody had lives and family things that were all happening simultaneously. So our communications officer has very young children, Myra, our other officer, was dealing with family coming back from university. So I think the first thing we did was, as a team, we decided that family had to come first because there were lots of issues that, the whole unprecedented situation was throwing up for everybody. And then after that, we sort of introduced as much flexibility as we could into the way that they were working. So rather than saying, OK, those are your normal hours, we were just saying, work when you can, do what you can. And I've got a great team. I totally trust them to just get on and do what was a priority in the best way that they could, trying to balance their other, sort of family situations. And they were brilliant. The support that I got from them was amazing. And also the other thing we had to look at, because we're quite a small team, we don't have a big infrastructure behind us, was actually how do we physically work? So making sure that they had the IT tools that they needed, and sort of making sure that people were safe and comfortable working in a home environment. So that was probably the team. Then from my own perspective, I'm probably the worst person on the planet for taking my own advice, which hopefully is sometimes good. But so I threw myself into 4 to 6 weeks of non-stop meetings and working, and it was good because it kind of felt like we were doing something valuable and meaningful, but you can't sustain that for very long. So I obviously had family coming back as well. My husband continued working. I've got an elderly parent living with me, so we had all sorts of challenges in terms of the work environment. But I think after that initial period, I had to rethink things and try to get some balance back into what I was doing. So that really just involved trying to make sure I did eat, even if my children weren't thrusting a sandwich under my nose while I was in yet another meeting, and trying to get some exercise. I think the thing I found a real challenge was I realised how much I use distraction techniques to keep me balanced, as in when things all feel too much, I take myself off and I go and, do something like go out for dinner, or I go to a theatre, or do something that kind of like reconnects me with the outside world. And it was quite difficult to do that. So I had to work out other ways of achieving that. And also I kind of learned quite a lot about gratitude and trying to focus not on what I was talking about in all the meetings, but actually the other good things that I had in my life, my family being back, and the fact we were all safe and still able to work. So I had to actively try and focus on some of the good things that were happening as well. So I feel much more balanced than I did in the 4 to 6 weeks at the beginning of all this.
It was extremely intense, wasn't it, in the first couple of months? And I like the idea of rebalancing, and also the fact that you learn so much more about yourself and about your team in that period. Thank you, Tania. My second question is this. So how have pharmacy teams adapted their services to ensure they have continued to meet patient need throughout the pandemic?
So, I mean, again, pharmacy teams have been unbelievable. I don't think I've ever been so proud to be part of the sector as I have been over the last few months. They were one of the only services that maintained face-to-face services throughout the pandemic, even at the height of the peak. And that was a real challenge because it was all new, you know, trying to protect staff while still trying to deliver services, the whole protection and PPE thing. They were really having to do that on the run because they were still trying to deliver services and still trying to maintain the safety of their staff and learning as they went along. So in the first few weeks of the pandemic, I think prescription numbers went up by 35%, and that's a challenge in anybody's world. And obviously associated with that were the issues then of supply, so getting the medicines, you know, distributed and making sure that they could order what they needed for patients. And they did a phenomenal job at adapting the way that they were working to, you know, make sure that they could meet patient needs, maybe sometimes not giving them everything that they needed, you know, in total quantities, but making sure they had enough to keep them going so that they could meet other patient needs as well, and manage that whole situation brilliantly. Obviously, on occasions they had to flex some of the hours that they were working, so patients might have noticed that sometimes the pharmacy wasn't open when they would normally have expected it to be. Some of that was around, you know, sort of maintaining the resilience of their staff, because it was really, really full on for pharmacy teams at the beginning. But also it was to give them time to focus on the real priorities. So sometimes they were working for short periods behind closed doors just to make sure that they could keep the workflow going. I think one of the consequences of, for example, GPs starting to move to a more closed door working style was that patients needed somewhere to go for advice and to understand what was happening in the system and to know how to access those other services. And quite frequently they were coming to pharmacies to say, I don't know how to do this, I don't know where to get this support. So not only did they have a massive increase in the number of scripts, they were also dealing with an awful lot more patient queries around their own health and also, you know, how to access the healthcare system as it now operated. And so that all took some real planning and, you know, process changes to make sure that they had staff available to support patients with, you know, those queries. So throughout that period, they still managed in a very COVID safe way, as the guidance sort of developed and went along, to deliver their normal prescription services, you know, minor ailment support for patients to try and keep them out of GP practices where they were struggling to deal with some of the more complex issues. And they also fantastically continued to deliver things like the harm reduction services and some of the sexual health services, which again had been impacted by some of the clinics closing. So really, I think they did a fantastic job, and I think they've been recognised both locally and nationally as some of the heroes of the pandemic, because they really stepped up to the plate and continued to deliver the services that patients really needed.
Yeah, no, I remember messages about when the clapping used to happen, was the fact that people were being reminded that pharmacists are part of the NHS, and that to remember them. And of course, you rightly say that you remained there as a system, as a service throughout, offering face-to-face provision where that wasn't happening elsewhere. Did the pharmacists work with the volunteer groups that were helping to deliver prescribed medication?
So yeah, I mean, from my perspective, that was one of the big successes of the pandemic planning. Obviously, when we had people who were shielding, they needed to have a way of getting their medicines, and that was done in two ways. Firstly, pharmacies stepped up some of their delivery services that some of the pharmacies already offer, And that was fantastic because none of those are NHS funded, so the pharmacies are doing that out of their own pocket to meet patient need, and again they really stepped up to the plate there. But then we worked really closely with the system on making sure that deliveries through the volunteering services, and again the Home But Not Alone service in Suffolk I think was second to none really, not just in what it achieved but the governance that sat behind that, which is really important with medicines. The pharmacies needed assurance that if they were handing over medicines to a volunteer, that they knew it would get to the right person, that the right safeguards were in place to make sure that that patient knew what they needed to do with their medicines. And that was a whole system response across voluntary sector, the CCG supported, and we ended up with, I think, a gold standard service for delivering medicines to patients in Suffolk, which was a great team effort.
That's brilliant to know. Thank you. So, very short next question, which is what's next for community pharmacies?
Okay, so I think most of them have had a well-deserved break over August and probably into early September, where they're trying to obviously build their resilience for the next stage. And I think the next big thing on the horizon for pharmacies is the flu vaccination programme. So that's due to start mid-September, and obviously they deliver that vaccination programme in conjunction with GPs and other providers. But this year there are several challenges. Obviously the whole COVID safe delivery of the service means it's got to be done differently. So whereas previously we could probably vaccinate people quite quickly, now the additional procedures mean that that process won't be quite as swift as it has been in previous years. So managing the whole, workload and the delivery around that is something that pharmacies have been planning for a while. The NHS have actually extended some of the cohorts for the flu service, so it can be delivered to more people than it ever has been before. So that's an additional challenge in terms of achieving the targets that the government have set, and they are there obviously not just to safeguard the health of the patients, which is the primary concern, but also to manage the demand on the NHS over the winter period. So if we can protect more people against flu, then there'll be less people accessing, secondary care hospital services due to pneumonia and complications from flu. So it's there as well to make sure that we support the NHS. And so there are some real challenges in delivering that service. And as I say, that's going to be, I think, probably the major focus from mid-September, probably right through beyond Christmas, in order to make sure that as many people as possible are vaccinated this year.
Quite. I've got a question about that, which is, what are the most important, or who are the most important people that need to consider getting a flu jab? And the other question I really had about the sort of what's next is, were there a cohort of staff in the community pharmacies who were being shielded, who are now coming back to work?
Okay, so on the flu point, so the main people that are targeted for vaccination are obviously similar to the groups that we were protecting from COVID. So over 65s, those with underlying conditions, so diabetes, respiratory problems, they are all regularly given the opportunity to have the flu vaccination, and obviously we'll be encouraging as many people in those groups as possible, because they're also the ones that are more vulnerable to the effects of COVID. Or anybody who would have been shielding, so people who've got underlying conditions, whatever their age group are, and that does include some sort of other groups like pregnant women, also some carers, because obviously we need to make sure that carers are well protected so they're not passing it on to the people they care for, and to keep them resilient so that they can continue to do the fantastic job that they do in supporting some of our more vulnerable people. So that's what we would generally expect from the flu vaccination programme. but this year there's a possibility that come November they'll be extending that service. And part of that is around, again, protecting those people who might be more vulnerable to COVID. So some of the younger people from the 50 to 64 might be eligible from November onwards. And again, the at-risk people in those categories. So that's who we'll be looking to encourage to have the vaccination this year. So in terms of the shielding, so in the same way as anybody else, pharmacies did lose some staff who had to shield, and all staff now in pharmacies have been risk assessed to make sure that everybody understands what their underlying risks are. And then obviously workflow can be managed on that. So if people have got specific, sort of risk factors, then they can be kept away maybe from some of the more patient-facing roles, and that reduces their risk of coming into contact with somebody that might have the virus. So most of the shielding people are back in the workplace, but they will all have been risk assessed to make sure that whatever they're doing, if they are back in the workplace, is appropriate for their specific risks.
Oh, good. That's good to know. Thank you. My last question is about the future. So what learning and maybe what challenges do you think will come from the outbreak?
So I would say in terms of the learning, most of the I guess benefits that we've seen system-wide in working has all been around the IT and the fact that virtual consultations have been, sort of used effectively, and obviously in terms of the system, we've all been able to work differently and still be productive in delivering outcomes for patients. I think to some extent the reverse is true in community pharmacy, in that we've always had a bit of a drive towards, pharmacy being around dispensing prescriptions, and maybe that could be done differently. That might just be a process or a function that could be delivered, through an internet type service. And I think really what pharmacies have shown throughout this period is how valuable that face-to-face contact is with patients, and that absolutely, there's got to be a mixed model going forward where we look at how we use those technologies to I would say, prioritise rather than replace some of the existing services. So there definitely is a place for that, but there is very much a place for face-to-face interactions that help to reassure people about their health, help to manage their own health in their communities, and that whole support piece, which isn't always as easy if it's done sort of virtually. So I think that's probably part of the learning for pharmacies. I think probably more than ever we have worked in a more integrated way with the rest of healthcare provision throughout this. Certainly as an LPC and our representation, we've had amazing support from the system to understand what our pharmacy teams needed and how the system could support them. And so I think one of the learnings really is how do we carry that forward, and how do we continue that integration of pharmacies, and also maybe around the understanding for patients as to what pharmacies can do for them. So it's not just the dispensing of a prescription, which obviously is an important function, but there are so many other things that pharmacies can do to support them with their own health. And so I think we need to take the learnings from how patients have viewed those services through COVID, and they've been really supportive and complementary of the way that pharmacies have stepped up to the plate, and how we can develop that relationship and use it to more effect for better outcomes for the patients. I think probably the challenge that we have is that we, like many other organisations, still have issues around the funding model that supports community pharmacy. I think we've talked before, Andy, about the fact that in 2016 there was a reduction in funding to community pharmacies, and that's actually resulted over that period in nearly a 10% loss in community pharmacies just in Suffolk. And so really we need to stop that, I think, and we need to reassess what we actually want our pharmacies to do, how we want them to support the rest of the NHS, and we need to look at working with government to fund that effectively, so that pharmacies can actually develop their full potential, and we can use all the skills that those, sort of well-trained and dedicated teams have got for the benefit of our local communities. So I think that's certainly my challenge, and one that I'm totally up for. So that's what we're going to be looking to do in the future.
Yeah, no, you've been fighting on that front for several years, Tania. I know that, and it's good to know that you've been more recognised during this pandemic, and there are some good things that have come from it, and one is about integration and collaboration, and we don't want to lose that. And of course, what you started off by saying, and I think in answer to my second question, is that patients have become more aware of what it is that you offer during the pandemic as well.
Yeah.
So that's been helpful, and it's good to know that as a learning, you want to have some kind of hybrid between digital and face-to-face, rather than move totally or towards digitalization. That, and I know patients and carers will really hear that well, and commend that. Tania, thank you so much for your time.
You're welcome.
I really appreciate it. Thank you.
Okay.